Welcome to another Hospital Rounds video. I'm excited for this one. This is going to be of our skilled nursing facility, MacRitchie and McGuire. And just as nurses and doctors have to round on their patients to ensure timely care and keep their patients up to date on their care plans, so we are rounding on our different services and facilities and units of the hospital in the hospital system to ensure that you, our community, is in the know and up to date on what we're doing here at the hospital and the care that we're providing. Again, we're here in our beautiful MacRitchie facility. This is our long-term care unit. I'm excited to be here with Carol Gibson. Welcome, Carol, to the video. Can you please introduce yourself for our community?
My name is Carol Gibson. I am a clinical nurse manager here for MacRitchie and McGuire. Okay. I've been at the hospital for 13 years and really enjoy my position and all the variety of things I get to do.
Wonderful. So tell us a little bit about the care that we provide here. Can you give us an overview of what's the difference between MacRitchie and McGuire? What are the services that we provide?
Okay. Services are about the same, but MacRitchie is their forever home. So look at it that way. They're here to make sure we're providing them with meals, daily care, their medication, medical management of their disease processes, and most of all, just making them feel comfortable, making this their home.
Yeah.
You know, none of them probably thought that this is where they would end up, unfortunately. Yeah. So we try to make their rooms are private, and we let them decorate it the way they want and have their personal belongings in there. We provide activities for them. It's very routine over here. We're here for them. We get on their daily routine. Do they like to sleep in? Do they want to get up early? When do they want their breakfast, their lunch? What do they like to drink, eat? All those things. Yes. So a lot of family involvement. So that's MacRitchie. McGuire is more of, they've had something happen to them. They might have had a surgery. They might have had a joint replacement. And then their goal is to get stronger and go back home. Some of them to a lower level of care, maybe home is in it, so assisted living, and we help educate them and prepare them for that. Maybe some of them will also transition to long-term care, or maybe you have to go live with a loved one, which is hard for them because they're giving up their independence, they feel like. So that's what McGuire is. They're going to get therapy. We're going to help educate them. We're going to teach them for their next level.
I know that your team does a fantastic job of transitioning patients from their short-term rehabilitation into whatever that next step is. I know we have all of these wonderful resources in place from Hillsville Hospital and also from our community, and we'll be talking to one of those agencies in just a few minutes. Carol, can you tell us about the overall mission and kind of strategy of this facility?
Just to make sure they have a good experience. Unfortunately, you know, like I said prior, MacRitchie is long-term care. A lot of them did not decide that's what they wanted to end up. And the same with McGuire. We want to know what their goals are, what makes them comfortable, and get them to where they're happy. Whether it's long-term care or wherever it's at. So their goal is to make sure their experience here is the best it can be.
Well, I love coming in here because all of the residents are always smiling and happy and interacting with each other and with the staff. I think that's wonderful. I've been in a lot of nursing homes, but your team, the care that you provide is just so personable and meaningful. So thank you for making this feel like home for so many patients and residents. That means so much to them and their families. Last question. What do you want family members of residents to know? What do you want them to know that if they have someone who might be transitioning into long-term care soon, what do you want them to know about things like respite care that we provide? Can you kind of talk to that?
So respite care is for someone that is trying to keep their loved ones at home, which in today's world, they try that very hard. It can get very taxing. And maybe they want to go on a vacation or they want to go to their loved one's wedding that's out of state or something. So they can do respite care, and it varies. It can be up to 7 days, but typical respite stay is a 5-day, 4-night stay. There's a lot of information out there. It can be privately covered. Or insurances will cover it. So there's, if anybody wants more information, they can reach out to us about that. But it's just a 5 to 7 day stay that we provide their 24-hour care. We're taking care of them. We're giving them that comfort and in their comfort so they can leave and take care of what they need to.
And does that happen upstairs in McGuire?
Yes, they would stay in McGuire because we are over here on MacRitchie. We have 19 beds and we are always full. So
19 beds here. How many beds upstairs?
19 as well.
19 as well. Wow. Wonderful.
So we are, you know, it's a privilege to be in a smaller rural area as far as that, because you do know these people. You get 19 people to give the best care you can too every day.
And we know that this is state-of-the-art care because I believe it's 13 times now that our skilled nursing facility has been named a U.S. News and World Report Best Nursing Home. That's incredible.
Yes,
13 times.
That's
crazy. And I have no doubt that will continue because
it is an honor to hear that. So
yeah. Thank you so much, Carol.
Yeah, thank you.
I am now here with Stacy Lee, our certified nurse practitioner. She is one of the hospitalists on our skilled nursing facility team. Welcome to the video, Stacy. I'm so excited to have you here. Can you please introduce yourself for our community?
Sure. I'm Stacy Lee. I have been a nurse practitioner for almost 11 years, and I have spent that entire time here at Hillsdale Hospital. Our team takes care of the skilled nursing facility patients and the long-term care patients as well.
Wonderful. Tell us a little bit about what that care looks like. How regular is it? What kind of care are you providing for these residents?
So we see the patients every 30 days or as needed, and that's by myself, one of my colleagues, or one of my physician colleagues as well. The benefit of that is we are here in-house 24/7 and available to the staff. And if something comes up in between those scheduled visits, we're here and able to see them for anything acute that may arise also.
Yeah, and what are the different kinds of services that are available? Because this facility is part of the hospital, it is a little bit separated, and this definitely feels more of a homey, familiar space for our residents. But what's the benefit of being so close to all of these other hospital services?
So we're still able to, connect with our specialty services, and if somebody's having an issue that requires general surgery, we put a consult in for that. Same thing with orthopedics. If they have any sort of like bone-related injury, we can consult with them. Psychiatric. I mean, we still have access to all of those specialty services as well.
That's amazing. So podiatry, wounds, I'm assuming, all of these very specialty services that are literally here in the building.
Correct.
That's very exciting. We'll talk a little bit more in a while about what happens when a resident does need to go out of the hospital for some other kind of care. But Stacy, one more question. I want to ask you about your approach to patient care and your team's approach to patient care. What is your kind of vision for how residents can thrive here medically?
So I think on the skilled nursing facility side, it's, we want them to rehab and get back home, or we want them to get back to wherever they were prior. The long-term care side, this is their home. So we want to make this as homey as possible. We want them to thrive, be comfortable. We want them to be able to do fun things, and we don't want it to necessarily be hospital-like. So we try our best to facilitate them going out with family and doing activities here. And many of the residents have been here for more than 10 years. So
yeah, that's so great that that's all really a part of their care, a part of their care plan. And I know it makes a difference. We hear wonderful things about this facility. Thank you, Stacy.
You're welcome. Thank you.
We are in a new space. This is our beautiful patio of the skilled nursing facility. I'm here with Amanda. Welcome, Amanda. I'm excited to have you here.
Thank you.
I'm going to have Amanda introduce herself, but I will just kind of start introducing her by saying she is a recent award winner of Hillsdale Hospital. She won one of our patient care awards for being an excellent caretaker of our residents here at the skilled nursing facility. And she is known for her personalized, effortless care. So many patients have such good things to say about you, Amanda.
Thank you.
Can you tell us a little bit about yourself? Introduce yourself.
Yep. So I'm Amanda. I've been here it will be 3 years in December.
Okay.
I started from minimal healthcare background. I wanted to go to school for nursing and thought this would be a great place to kind of transition, get my feet wet a little bit. And it's actually helped a lot. I've grown to really love my position here. Although I'm still excited to be a nurse eventually.
Yeah.
But it's great. You get to make a difference in somebody's life, and it's like I get to spend the day with my grandma or grandpa all day long, kind of.
Yeah, and that's so meaningful for them too, of course.
Mm-hmm.
So tell us where we are. What is this used for?
Okay. So this is the patio. Our residents can come out here for a variety of activities, which I know you'll speak with Jordan about later, but they have a garden during the summer. Yesterday, actually, when I worked, we just opened up the patio door. It's a beautiful sunny day. They just kind of came out and they get to, conversate, be with each other, but enjoy the weather with a little bit of freedom being outside.
Absolutely.
But they're also obviously safe. So yeah, they love it.
Oh, that's wonderful. I love that you can just kind of see Hillsdale. This is a great place to be. I love seeing the residents parked out here in the summer.
They love it when you honk when you go by. So honk as you pass by if they're out here.
Great to know. I'm going to start doing that.
Yep, they do.
So tell us a little bit about your day-to-day responsibilities. You're a certified nursing aide. What is the difference between that and an RN, and what do you do with the residents on a day-to-day basis?
Okay, sure. So, so a certified nursing aide, we are responsible for the assisted daily living that a resident would do. We come, we help them wake up in the morning, get dressed, get washed up, showered if need be, do all of their personal care. We do promote like safe independence. So if they're able to stand at the bathroom sink and brush their teeth on their own, then we're there to support them and help them do that safely. We help them, serve their meals. If they need assistance with eating, we'll help them with that. And then taking them to activities, or even sometimes it's just talking with them and spending time with them.
How does that have an effect on your residents who maybe were nervous to be in a facility, or maybe their family was nervous about it? How do you try to make sure that that family is really comforted and knows that they're getting the best care possible, not just on a medical level, but on an emotional level as well?
Right. So it's super important. And I think a lot of our resident families would tell you that as well, that we are very personable with our family members of our residents as well as our residents. I can tell you almost every resident's, daughters, granddaughters, grandsons, all their names, because we're just so invested in them. And all the care that we do is personalized to every resident. They all have their own personalized care plan, whether they want to sleep in or, they like to wear this shirt on a certain day. Everything is so personalized to our residents. And we're a smaller unit, I think. So they just get so familiar with us. And that's great. I love that. We're very, they know all of our family, you know what I mean? They'll ask about our children and all that stuff. So it's really great. We have such a close-knit, small community here.
And I think it's important to know for those families that, when a patient does need to be a resident here, it's not the end of them forming new relationships and connections. It's really a beautiful family that you have here. So I love being in this unit. It's so warm and welcoming. I love talking to the residents. So thank you so much, Amanda, for the work that you're doing here.
Thank you. Thank you.
We are now in the beautiful dining and activities room of our MacRitchie facility. I'm here with Jordan. Thank you so much for being here, Jordan.
You're welcome.
Can you introduce yourself and what you do here?
Yes. Hi, I'm Jordan. I'm currently the activities coordinator. I started out as a CNA. So I just plan all the activities for the residents and meet their needs.
Amazing. Can you give us some examples of what we use this beautiful space for?
So this is the dining area. The residents eat most of their meals here. Some of them eat in their rooms. And then we host the activities twice a day in here at 11 and 2.
Wow, twice a day.
Yep.
Okay, can you give us some examples of the types of things that might happen here?
So every Monday they have Bible study, and then we have various entertainments that come in, and then we like to play games at least once a week. The residents love Crazy Eights.
Oh, I love that. That's a great game.
Yes, they love Crazy Eights.
Wow. Okay. I know over Christmas I've seen like decorating Christmas cookies.
Yes.
That's so
we
fun.
do cooking club every Friday, so the residents make various desserts, dips.
Wow.
Basically whatever they're in the mood for to make that is easy, that can meet their abilities, I guess.
Yeah, so they can kind of guide it. That's really nice. What is the benefit of having this kind of space and just having a regular schedule of activities for our residents?
It makes sure that the residents aren't being isolated to their rooms.
Yeah.
Because a lot of them, I guess, wouldn't come out to socialize with other residents if we didn't have the activities.
Yeah.
So it's making sure that they get that daily interaction with their peers.
That's wonderful. And we also have the community coming in sometimes as well. Can you tell us about that?
Yep. So we have several volunteers from the college every week that interacts with the residents, plays games.
Yeah.
And then we have the church here today. They come every Monday. And then we're having a petting zoo coming this afternoon.
Ooh.
So this is the first time we've done this, but I can't remember the
That's okay. That's exciting. What a big variety of things. That just gives so much, social life to the residents.
And then a big shout out to Scotty Butters. He comes at least once a month.
Okay.
And that gives the residents live entertainment that they normally wouldn't get.
Some music?
Because they can't leave the facility, a lot of them.
I know in the fall we did trick or treat here. We actually have, we're our stop, so next Halloween, for trick or treating, make sure to come in and get some candy from the residents. They love to see all the costumes.
They do. We have a lot, we give out a lot of candy. I can't even count how many bags we do each Halloween.
Yeah. So. Oh, I love that. Well, please, if you're a part of some group, or if you do something in the community, who should they reach out to kind of talk about bringing it here?
They would reach out to me. My email is jordanshamp@hillsdalehospital.com, or the phone number is 517-437-6204.
Yeah, so if you have an activity that you think you could bring here to just share with our residents, please reach out to Jordan. It makes such a big difference for them.
It does.
And it's a wonderful thing to do.
Yep.
So thank you, Jordan, for everything that you do for our residents.
Thank you so much.
We are now upstairs in the short-term McGuire unit. I am here with Caitlin Bartley, our charge nurse of this unit. Caitlin, can you please introduce yourself to the community?
Yep. So I'm Caitlin, and I am the charge nurse here. I'm the McGuire and MacRitchie skilled nursing facility. I have been here almost 12 years now. I started out as a CNA, and then as a floor nurse, and then now a charge nurse. Yep. So this is where I've been.
Wonderful. So tell us about the short-term unit. We heard a little bit about it earlier, but can you share with us what is really the goal of the short-term unit? What is the kind of care that you provide, and what are some of the conditions or circumstances that might lead a patient here?
Yes. So most of our patients, we have a wide variety, but most of them either post-surgical of some sort. It could be they went down and had a hip done or a knee, and that they just need a little extra rehab prior to going home. Typically those type of stays, they're here about 2 weeks before they're able to go home with a home care service. Some other ones are wound care that they weren't able to do at home, strokes, heart attacks. We do get hospice up here occasionally, and respite stays, but for the most part, for the short-term rehab side, we see our patients here on average, I'd say 2 to 30 days, or 2 weeks to 30 days.
Okay. Yeah. Great. And tell us about the kind of mission behind the care that you're providing. What is your goal with each patient?
Our goal with pretty much every patient is to get them back to whatever their prior level of function was prior to coming to us. So if you were able to be at home walking before, we aim for that goal, or to get them back to the next level of care, which would be home with home care, or maybe extra help in the home. Or extra private services in the home.
Perfect. Very individualized care,
yes, very
personal to each patient. Okay, well, let's change gears a little bit and talk about infection control. A lot of times, sometimes infection happens at the hospital just because there's a lot of sick people here. And I know that everybody on our team does everything possible to protect patients from spreading that infection. But tell us about some of the specific measures that we have in place. So BioVigil, let's talk about that a little bit.
So BioVigil is a newer company that we've been using. I think we've been doing it now a couple of years up on our unit. But the goal is to making sure our staff are washing their hands in and out of patients' rooms to prevent the spread of infection.
Yeah. Can you model it a little bit for us? So it's on your badge here.
Yep. So this is my BioVigil badge. And then before I would go into a room, I would hand sanitize, wash my hands, and I would cup my hand over my badge, and it will beep.
Okay.
And it means that I washed my hands prior to coming into the room. Each room has sensors, so it motions. If I didn't wash my hands when I went into the room, my badge would turn yellow. Kind of beeps and gives me a warning. And then if I'm in there longer, it turns red.
Okay.
That means stop what you're doing. You need to go wash your hands.
Yeah.
And then on the way out, I'd do the same thing. I would hand hygiene, walk out, and then my badge would turn green.
Okay. So it's a great reminder for you, but it's also good for our patients to kind of see, their badge is green, they're washing their hands, and just to kind of have that visibility. That's great. So let's talk about the roll-up screens. What is the difference? Why do we have these instead of the traditional curtain?
So we recently transitioned to the roller screens. They're just easier to wipe down in between units, or patients, I should say. And they're colorful.
Yes.
But they're easier to wipe down. They roll in to get out of the way. we kind of got rid of the cloths just because of washing. These are way more sanitary.
Absolutely.
And then the other thing is our UV lights on the ceilings, which does like a constant sanitation in the rooms.
Yeah, really provides that extra level of infection control by monitoring the disinfectant, and it's also motion sensing, so it will kind of emit a spray that disinfects the room. That's not really, you're not able to see it or feel it or anything. It just really keeps the room perfectly clean. So thank you so much, Caitlin. I appreciate you being here. Thanks for showing us around. This is incredible care that we're providing here. Absolutely state of the art. So thank you.
Yep, thank you.
We are now in the therapy gym in McGuire for our skilled nursing residents. I'm excited to be here with Heather. Welcome to the video, Heather.
Thanks.
Could you please introduce yourself to the community?
Yeah, my name's Heather. I am an occupational therapist here. I have been working for Hillsdale Hospital for 13 years. I've worked in sort of all of our settings. So our inpatient, our this setting, skilled rehab, a little bit of outpatient. I sort of have experience everywhere.
Yeah. So this gym, this beautiful space, is right in the short-term unit. But if I'm correct, I believe it's for both short-term residents and long-term residents.
Yeah. So we see both people short-term. So some people need to come to our rehab floor after hospital stays. It can be for an elective surgery, like they purposely get their hip replaced, or maybe they got pneumonia or had a heart attack, and they're just not up to par and they need to come here for short-term rehab. So we see those patients. Then our hospital also has a long-term unit where we have residents who stay here. And if they have a decline, we also can pick them up for therapy, sort of to boost them back to their best level.
Yeah, it's just a walk down the hall, really.
Yeah.
Go down the elevator.
Which is why we love it.
Yes. And I love that everything is so integrated with the rest of the hospital, so that short-term and long-term all have access to the best services possible. So tell us a little bit about rehab therapy. What kinds of therapy do you do here, and what is your goal?
So occupational therapists focus on getting people as independent as possible with their self-care. So that can be different for everyone depending on what their normal level is. So if people live home alone and usually take care of themselves, cook for themselves, get dressed, those would be our goals. That's what we work on. So we work on true functional activities, but we also use exercise and therapeutic activities to sort of boost their endurance, their strength, so they can do those things they want. We also have physical therapists here who work on balance, mobility skills, leg strength, to improve someone's ability to transfer, walk, and access their house and their community.
Absolutely.
Yes.
I'm sure that after some injuries and illnesses, there can be a level of maybe fear or maybe discomfort with trying to get back to something that you used to be able to do. How do you really come alongside patients and help them through that journey?
I think it's really meeting people where they are. So sometimes that means going sort of a little bit slower so people feel comfortable, and building rapport with them. You're not just a patient here. We learn about you, what's important to you, and we use that in your therapy because that's motivating.
Absolutely. I love that. I love what you're doing here. It's so meaningful. And I'm sure that there's a lot of exciting moments when milestones are reached. Do you do anything to celebrate the milestones?
Sometimes it depends. Some people, if they've come here and they were unable to walk and they take those first steps, very frequently we will all be lined up to celebrate it.
That's so wonderful. I love to hear that.
Yes.
Well, thank you, Heather. This is incredible work that you're doing here.
Thank you so much.
For admissions and discharges, when you're coming to and going away from the unit, we have Courtney here to help you. Thank you, Courtney, for being here today. Can you please introduce yourself and what you do here at the hospital?
My name is Courtney. I am the admission and discharge coordinator for the McGuire and the MacRitchie units.
Perfect. So tell us about admissions. What should the community know about when a patient is being admitted into our facility? What is that process like?
A lot of our referral source comes from other hospitals. So we use like a portal system for that. And the first initial thing that we do is verify their insurance to make sure that they're in network with us.
Yeah, and kind of talking through like the different types of care that are going to be provided, I'm sure. And then once they get here, of course, that care is all taken care of up to the point when they leave. What is that like to kind of prepare a patient to take the next step? What do you do in preparation for that?
So we have a lot of contact with the family members as well. Family members that they either live with or that are a big part of their life.
Yeah.
We talk to them on the phone, but we also set up like care conference meetings. So we'll have a meeting in the room with the therapist and nursing staff and myself and any family members that they wish to come to kind of coordinate and talk about their care, like following the skilled nursing facility.
Okay, that's great. So really keeping the community, the family members up to date, especially if that's a family that does provide kind of the care at home. I'm sure that's very meaningful. What are some of the resources that either we provide or we can connect a patient to on their way out the door?
So there's a lot of resources in the community. We typically, when patients leave from us, they are going home with home care services for physical, occupational, and sometimes nursing staff if they need them. So we'll set them up with home care.
Okay.
Or if hospice were something that they were more appropriate for, then we would set them up with hospice.
Okay.
We also use like the Region 2, like Wellwise services.
Wonderful.
Under their Medicaid waiver program. So.
Yeah, awesome. So many different connections, and I know that you all do an excellent job just making sure that the patient is ready and the family is ready to kind of make that transition back to home or wherever that is. So thank you so much, Courtney, for the work that you're doing here. I know that when someone calls the skilled nursing facility, you're probably the one picking up and answering the phone.
Yep.
Thank you. What is that number that people can reach you at?
The phone number is 517-437-5233.
Perfect. Thank you.
Thank you.
I'm excited to welcome Eden to our video now. Eden, thank you so much for being here in this video. I'm excited to introduce you to the community. You're not a Hillsdale Hospital employee. Can you tell us who you are and what agency that you're a part of?
Sure. So my name is Eden. I'm from Wellwise Services Area Agency on Aging. I'm a clinical supervisor there and manage a few of our programs.
Amazing. So tell us about the relationship that Wellwise has with Hillsdale Hospital, especially our skilled nursing facility, and how you help out our patients.
Yeah. So our Navigation Home program is contracted with the hospital. We receive referrals from people who are going to be discharging and may need some support when they get home. So we get those from you guys. And then on the long-term side of things, we have another program called CTS that can help people transitioning home.
Perfect. And what kinds of support and help do those programs provide?
So in Navigation Home, we provide case management. We help with transportation to doctor's appointments, making sure those follow-ups are happening. We assist with education, reviewing discharge paperwork, making sure people understand their diagnoses and how to hopefully not be admitted back to the hospital.
Yeah, that's wonderful. So it's really that continual, ongoing support. Can you give us some examples of the types of help that you can provide that might not be anticipated as things that someone might need when they go home?
Yeah. So sometimes maybe insurance isn't covering like DME needs, so medical equipment when they get home. Sometimes maybe there's some assistance we can give with a referral to like a department on aging for some in-home help, whether it's personal care or housekeeping. There's just kind of a variety of things that can be referred to and maybe assist somebody in their home.
That's wonderful. So you have these programs for both short-term and long-term care, and I know that you just make a huge difference in the lives of our patients who are going home and just need that extra support, whether it's just dropping off groceries for them or spending some time with them, whatever that looks like. Thank you for the work that you're doing and for the work that this agency is doing. Usually when someone is discharged, they're going to meet a Wellwise person, correct? What is that process of getting connected?
Yeah, so we have an options counselor that visits in the hospital prior to people discharging, and so you might meet Kelly in person, who's the one who comes and does that. And then we typically like to see you again at home to do an assessment. make sure you have everything you need in the home, that kind of thing.
Okay.
So, and then after that, it's just a phone call every week for about 4 weeks or so.
Oh, that's great. Just to, check in. That's great.
Yeah, yeah.
Wonderful. Well, thank you, Eden. I appreciate it.
You're welcome. Thank you.
Thank you for watching another installation of our Hospital Rounds series. We enjoyed taking you around this beautiful facility where our long-term residents live and our short-term residents receive such excellent care. We're so grateful for our teams who are supporting our patients here. They do incredible work. The patient care is just unmatched. Thank you again for watching. If you want to learn more about our skilled nursing services, you can visit hillsdalehospital.com/SNF or go to our services and just find any of the services that you're looking for. You can find more information, get the phone number to call, and learn more about the care that Hillsdale Hospital is providing here in our community. Catch our next Hospital Rounds video coming in just a few weeks. And until then, remember, rural health strong.